March 9th, which was 2 days after New York, even though we had far fewer cases. And we've taken a number of actions to be able to address the spread of COVID-19 in Florida. Initially, when people were coming in, the idea would be to identify them if they had come from Asia, particularly Wuhan, if they had come from later Italy when the outbreak was there. You would identify them, see if they had symptoms, test them, and then if they tested positive, you would trace their contacts, isolate the people who they had close contact with so you wouldn't have spread. And that's done by the Department of Health officials at the county level. They worked very hard, probably more than any health department has ever worked in modern American history on doing that. And I think that they were successful in the initial phase of blunting the spread of COVID-19. But of course, we did a lot more than just that. If you look at some of the things that we've had to do, we essentially stopped visits to nursing homes and assisted living facilities statewide. We imposed really rigorous requirements about the staff members who could go in, what you had to do to check their health. And that was because we knew pretty early on that this was a virus that the elderly in particular were very susceptible to. And so that was something that was important. And I got to say, the vast majority of these facilities in Florida have been very rigorous with doing that and following the state regulations. We shut down visitation of prisons statewide. We limited public gathering places consistent with CDC's guidance, whether that's restaurants, whether that's gyms, whether that's bars and nightclubs. We recruited over 100 additional epidemiologists to assist with the contact tracing of the people who had acquired the virus in Florida. We activated and deployed the Florida National Guard to assist with logistics and testing sites. We've stood up a number of drive-through testing sites throughout the state. The Guard has been fantastic in doing that. We had to make some important decisions about hospital equipment, so we stopped all non-elective surgeries in the state of Florida to free up more hospital beds if need be, and the personal protective equipment that is used for medical surgeries and medical care. The schools have been closed and will be closed until April 15th. All the remaining assessments and testing have been canceled. The state college and universities are doing virtual learning for the rest of the semester. We work with the Board of Governors to provide refunds or credits to university students for the unused portion of their residence hall food service payments. We suspended licenses, renewal requirements, driver's license. We activated the state bridge loan program for small businesses. So there has been a huge amount of actions that have been taken, and a lot of these actions have resulted in really significant changes to the daily lives of Floridians. And so this is something that I know people see every single day, and I know a lot of people have questions about, well, how long is this going to go on? What's next? What's next? And I can tell you, my own wife has the same angst, and so that's natural. So here's where we are. We've had over 1,100 Floridians test positive for COVID-19. There are a handful of states that are, obviously New York very much ahead of us. Some other states are ahead of us. For our population, we'd probably be roughly average. We've had 14 fatalities, and the bulk of our cases have been in Southeast Florida, Miami-Dade, Broward, and Palm Beach counties. And so that is kind of the lay of the land for our state. We had a strategy with this from day one, and there was really 5 main components to it. The first was to stop the introduction of the virus into the state of Florida. So I advocated for things early on like travel restrictions from China and from Italy so that we didn't have people pouring into the state and introducing the virus. Number 2, we had to protect the elderly. And so some of the things we did with the nursing homes and the assisted living facilities, also messaging to people, be careful if you're around somebody who's elderly and has an underlying medical condition. Very, very important given how the virus acts on that population. Number 3, we wanted to expand access to testing. I know it was well documented, the Center for Disease Control, how the whole testing thing was working. We didn't want to just sit idly by, so the National Guard has been instrumental in expanding testing throughout the state of Florida. We want to continue to do that. One, it just gives us data points to be able to make decisions on. You need to know how prevalent the virus is. But two, it gives a lot of people peace of mind when you see this invisible enemy and maybe you start coughing, you wonder, do I have it? And so that's something I think that has been a recent success due to the efforts of a lot of people at the state and local level. We also supported things like social distancing. Some of those were mitigation efforts that were ordered by me or local governments, things like closing the restaurants, closing places where people can gather. But there were also things where we told people to take responsibility, make sure you're doing things like washing your hands and keeping your distance from people. This is a virus that if you are 6 feet or further apart, you're probably going to be okay and not going to be in the range where this could be transmitted. And then finally, 5, we want to prepare for any hospital surge that could result from the transmission throughout the community of COVID-19. And that has been really the strategy from the beginning, and I think we've done a lot to execute on that strategy. Now, some people have said, well, we just see New York, they've issued a shelter in place for the entire state. Shouldn't Florida do that? And I think given our circumstances, that would not be advisable. It would be a very blunt instrument. When you're ordering people to shelter in place, you are consigning a number, probably hundreds of thousands of Floridians to lose their jobs. You're throwing their lives into potential disarray. And if that were something that were necessary statewide because the health comes first, that would be one thing. But if you look at Florida's situation right now, this is not a virus that's impacting every corner of the state. We have 20 counties that have 0 cases at all. And we have about 25 counties that really have only a few cases. Some have 2, some have 5, some have 7. You do have an outbreak in Miami-Dade and Broward counties, but those are different from places like Northwest Florida. And so if you're looking at that, somebody who has a job in a place where there's no positive test anywhere in the county, the chance of transmission is probably very, very small there. Much different calculation than if you're in Miami or Broward. So I think it would be inadvisable to consign that person to real hardship if we honestly don't believe that it would advance the public health. So that's a problem. What we have done, though, is recognize that this is not a virus that has been introduced uniformly. We know that people who travel internationally have brought it back, and we're finding increasingly people with frequent travel to the state of New York, and so southern Florida and New York have a lot of back and forth. So I've worked with folks in Broward, Palm Beach, Miami-Dade to fashion additional mitigation measures that are maybe appropriate for their situation, but some of those measures would clearly be inappropriate if applied to other places. And if you have a county where there's 1 case, then the best way to contain that is to identify the person that tests positive, find their contacts, isolate their contacts, and test anyone who develops symptoms. We can still do that in certain parts of Florida, and we should do that if we can. It's also not clear to me that doing a massive shutdown of the entire state would even work. I think you're seeing in some of the states that have done this, there's really been huge non-compliance. I mean, it's like the party never ended. You got people congregating all over the place. You see images from California and Orange County. I don't think the beaches, they may have never been so crowded with people going out. Again, these are people who have been ordered to shelter in place, and they're not complying with those orders. And the fact of the matter is, a governor is not going to start imprisoning people just because they leave their house. So you're going to have a lot of non-compliance. And I think what we've also seen is there's a water balloon effect for all this. The minute you squeeze in one area, the water goes to the other part of the balloon. So in New York City, for example, when they issued the shelter-in-place order, or New York State, people started leaving. They started going to other states. And actually, many of them have been taking flights to Florida, which I'll address in a minute. And it's also something that these are measures that have actually never been applied in such a draconian fashion, really in modern American history. So we don't really know what effects they will have. If you have a lot of noncompliance, what will that mean for actually doing social distancing and stopping the spread of the virus if people are still meeting seeing? And then also, what effects will it have on the people who do comply, who are ordered to be confined to their homes? What effect would that be on people's mental health? What would that do to suicide rates, domestic violence, or child abuse? I don't know the answer to that, but I can tell you in hurricane situations, we typically see spikes in all of those things. And of course, we always have problems with things like drug abuse. So there could be real problems with doing something like that. And so here's the bottom line for me on this. I'll work with all of our areas. We've already worked with Southeast Florida, happy to work with our Central Florida communities, Northeast Florida, wherever you want to do, work across municipal and county lines. If there's an agreement about what would make sense for that region to help stop the spread of COVID-19, I'll be there to work with you, and we can get something enacted. But clearly some of these policies would not be appropriate in many of our counties that just simply have not seen much of this virus. There's another major concern about shelter in place. We would be doing all of this stuff. You definitely throw hundreds of thousands of people out of work. We don't know what effect that would have on the economy, public health, all kinds of issues with the people who'd be affected by it. But even if you did have a benefit, my fear about what's going on right now is that could be overwhelmed by all the people who are still coming to Florida. To this day, in fact, today, there's over 190 direct flights from the New York City area to the state of Florida. And I would reckon, given the outbreak there, that every single flight has somebody on it who is positive for COVID-19. And so as we're working to stop it in the state of Florida, you're consistently having people come in from one of the top hot spots in the entire world. We don't have people coming from Wuhan. We don't have people coming from Milan, but yet you have a flood of people still coming from New York City. And so these have been, in the last several days, hundreds of flights coming. And so here's what I propose to do about that. I think and I've talked to the president about it, if the federal government's not going to do any restrictions on the domestic flights, what we're going to do in the state of Florida, and I'll be issuing an executive order, is anybody traveling from those regions in New York or New Jersey to the state of Florida is going to have to do a mandatory 14-day self-isolation. That's the only way we can be sure that virus is not going to be reintroduced in the state of Florida and then spread. You have so many people working so hard. Many people have sacrificed to try to protect our friends and neighbors, and I just think it would be unacceptable to continue to allow it just simply coming in for people who are fleeing a shelter-in-place order in those states. So that will go out today, and hopefully that will be a deterrent for people. If you're just simply trying to escape here to avoid the restrictions that have been put in place in your own state, that is probably not a good idea. And so the final point I'll say is this. I think a lot of people are concerned about when does this end? And I think that we're in for a long fight, and I think we're going to be girded for battle. We're going to do all that we can, and it's not going to be easy. And I can tell you the people that have been working at the state level have been working nonstop, for almost a month, 7 days a week, 24/7. But I also know that you simply cannot lock down our society indefinitely with no end in sight. And when people say that we may do this for 7 to 9 months, I can tell you that is not sustainable. That is not something that the society would accept. So I think what we need to be doing as we do another week of the 15 days to stop the spread is to start working with the folks in Washington, working with other communities in Florida to say, okay, what does it look like, when we get beyond these 15 days? How can we do this fight in a way where people are not going to be locked inside their homes with really no end in sight? And so I'm already working on that. I'm talking with folks around the country, but I think that that is just a realistic way to look at it, and I think that will ultimately be probably the most effective way to be able to battle COVID-19. And with that, I'm happy to take some questions.
Yeah, Governor, do you plan on having people meet flights from New York and actually telling people they need to quarantine?
Yeah, we will.
How do you enforce that?
Yeah, so what we'll have is we will likely have local law enforcement or state law enforcement, and then we'll have someone from the Department of Health. And so basically, they'll have to meet on the flight. There'll be some information taken, and I think they're going to do temperature checks, and they're going to be told, you need to self-quarantine. If they say that they are going to go stay with family, understand that is not self-quarantining, because the number one way this is transmitted is close contact, almost all, very, very frequently family members. And so, it's a big problem, and it's just something that we have to address. Now, it's interesting. They had slowed the flights down. If you go back a week ago, I think there were like 20-some flights. I was still talking about that because I thought that could be a problem. But as soon as that shelter-in-place order came down from the New York governor, man, the flights took off. People just got the heck out of Dodge. And so we're ending up having to deal with this. The first part of our strategy to deal with this was to stop the introduction. Well, guess what? It is being introduced. And, we wish our folks and friends in New York well. They've got a tough fight. I think a lot of the folks there, from the governor and everyone, have working really hard, and I commend them for their efforts. But we also have to protect the folks here in the state of Florida.
So, Governor, are you going to say you're reassessing in another 15 days? And what would make you change your mind in regards to the stay-in-place order?
Well, we're going to go through with what the president's team put out with the 15 days. So that's obviously going to end shorter than 15 because they did it earlier last week. But I think we need to see direction from the CDC, from the president's task force about what this means going forward, and then we'll go from there. But look, I think Floridians are willing to do what it takes, but I think what they don't want to do is do things that really aren't serving the public health mission, because you'll have a lot of people who just simply won't comply. I mean, it's really interesting to look at some of those images that you see in some of those other states. And I think what I've tried to preach from the beginning is we're going to need to change, how we deal with one another until we can get this genie back in the bottle. But those measures need to be sustainable for the long term. And I think that we can get there, but I think it's not going to be stay in your house for 9 months. That's just not going to work.
Governor, last week the president signed into law the Families First Coronavirus Relief Act, which expands, Medicaid for the test. Do you support doing that with the feds paying for it? Do you support doing that? And why?
So they're going to do, we are going to get an increase in our Medicaid match rate. That's going to be a huge plus for the state of Florida. We typically have not fared as well on that. But the thing I would say to people about the coronavirus, if you're somebody that's symptomatic and you go in, you're going to get a free test. I mean, we're going to treat everybody. I know the health care coverage and all that. That's an important issue. But for this type of time, it doesn't really matter. And so we will make sure people have access to that test, and then if they need access to care. And so some of these other things, we'll figure out a way to pay for it.
So, Governor, it sounds like sheltering in place isn't going to happen. But what about some of those lesser protocols, like perhaps closing all the beaches across the state?
Well, I pretty much did that. I remember when CDC came with the 10-person guidance, I said that's going to apply to the beaches. And so the spring break was done. We closed the bars, and basically most of the beaches closed because in order to enforce my rule, they would have had to have put resources into doing that. Now, a couple counties wanted to do that because they wanted to give their constituents some access. So Brevard, they have the parking lots changed. They have deputies on the ATV. They had a boat going back and forth. And what did you see? You saw Floridians there with a couple family members, hundreds of feet away from the next person. And so, you know what? If they want to do that, that's fine. But my order ended all those parties. And the thing is like, if you have a mother just walking down the beach with their daughter, I think that can be done safely. And if they're willing to put the resources in, I want to give them the chance to do it. That is much different than doing a Jell-O shot off somebody's stomach. And we're not tolerating that. And we told them that the party was over. And I'm glad that they finally listened.
One more question for you, Governor. With over 30 ALFs now having at least a little bit of COVID-19 in them, are you testing all the residents at those assisted living facilities? And then secondly, go ahead.
Yeah, so the Surgeon General, we've looked at, we've expanded testing. Our Broward site that we opened with the National Guard, They did 750 tests the first day. They did 700 tests the second, 500 some the next, and I think they've done a lot today again too. So that's very important for the community. We also have some capacity to try to do some limited spot testing to see, okay, where is COVID? Because nobody really knows. And I think that's one of the difficult things with, like, how do you fashion a policy about this if we don't really know how prevalent it is? We don't really know how prevalent it is with people who don't develop symptoms and all this stuff. So how do you deal with that? We actually today, I launched with the University of Florida a program at the Villages where there will be clinical tests just to see if you have COVID or not. But then there's going to be tests that are going to be done for research purposes just to see with people who may not have very strong symptoms, is this thing circulating in that population, and try to get a handle on that. But the one place that we really think you need to do that, regardless of symptoms, is at the ALFs and the nursing homes. So the Surgeon General is working to get in there, do testing to see where the prevalence of this thing is. The one in Broward, you had all the staff was going in sick, and you're not supposed to go in when you're sick. That was very strict guidance. So, but I think that's important because if you can catch it, then you have a chance to prevent it from spreading.
As a follow-up to that,
All right, thank you for joining us. The coronavirus pandemic continues to affect us here in Florida. There are now over 1,100 confirmed cases statewide with 14 deaths. Of those cases, 267 are in Miami-Dade, 258 are in Broward. Monroe County has 2 cases.
The next update from the Florida Department of Health is expected at 6. But because of the outbreak, non-essential businesses in Broward County will have to close. Plus, tonight at midnight, a curfew goes into effect in Miami Beach from 12 a.m. to 5 a.m. every day.
Good evening, everyone. Thank you for joining us. I'm Jawan Strader.
And I'm Jackie Nesprell. And as more cases are...
Yeah, we could do that for sure if we got, and I'm not sure the numbers about how many ALFs. I need to ask the Surgeon General about that. I mean, we had been looking at the one in Broward very heavily. We actually have CDC's got someone embedded there. The Department of Health has someone embedded there, and we actually have law enforcement embedded in that facility. And then we have been looking